CNA test questions with answers, 55 questions with explained answers. Question 1. How often should restraints be removed? Option A, once a day. Option B, every 2 hours. Option C, every 4 hours. Option D, only if asked. The correct answer is option B, every 2 hours. Explanation. Removing restraints every 2 hours is a safety and rights requirement. Question 2. What is the clinical definition of homeostasis? Option A, the process of human reproduction. Option B, maintaining survival and a stable internal environment. Option C, the growth of muscle tissue. Option D, the loss of the sense of hearing. The correct answer is option B, maintaining survival and a stable internal environment. Explanation. Homeostasis involves the body's processes to keep vital signs and systems balanced. Question 3. What is the normal respiration range for an adult? Option A, 8 to 10. Option B, 12 to 20. Option C, 25 to 30. Option D, over 40. The correct answer is option B, 12 to 20. Explanation. Normal adult breathing should be quiet and regular at 12 to 20 breaths per minute. Question 4. Which vessels flow away from the heart? Option A, veins. Option B, arteries. Option C, capillaries. Option D, venules. The correct answer is option B, arteries. Explanation. Arteries carry oxygen-rich blood to the tissues. Question 5. If a resident consumes 4 ounces of juice, how many milliliters should the nursing assistant record? Option A, 60 milliliters. Option B, 100 milliliters. Option C, 120 milliliters. Option D, 240 milliliters. The correct answer is option C, 120 milliliters. Explanation. Multiplying 4 ounces by 30 milliliters results in a total of 120 milliliters. Question 6. What is the definition of a chronic illness? Option A, a sudden illness with a quick cure. Option B, an ongoing illness with no known cure. Option C, an illness that results in death. Option D, a temporary loss of memory. The correct answer is option B, an ongoing illness with no known cure. Explanation. Chronic conditions like heart disease require lifetime management. Question 7. True or false, semi-Fowler's is 30 to 45 degrees. Option A, true. Option B, false. The correct answer is option A, true. Explanation. This is a common position for resting residents. Question 8. What is the clinical definition of a non-pathogen? Option A, a germ that causes death. Option B, a microbe that does not cause infection. Option C, a cleaning chemical. Option D, a person who is healthy. The correct answer is option B, a microbe that does not cause infection. Explanation. Non-pathogens are often beneficial microbes found in the body. Question 9. What is the correct temperature for water used to clean dentures? Option A, boiling hot. Option B, ice cold. Option C, lukewarm. Option D, freezing. The correct answer is option C, lukewarm. Explanation. Lukewarm water cleans the dentures effectively without warping the plastic materials. Question 10. What does the letter R stand for in the fire safety acronym RACE? Option A, run away. Option B, ring the bell. Option C, rescue. Option D, report. The correct answer is option C, rescue. Explanation. The first priority in a fire is to rescue anyone who is in immediate danger. Question 11. What is the term for blood in the urine? Option A, dysuria. Option B, hematuria. Option C, nocturia. Option D, polyuria. The correct answer is option B, hematuria. Explanation. Hematuria is an objective finding that must be reported to the nurse. Question 12. What is the correct direction for washing the perineal area of a female resident? Option A, back to front. Option B, front to back. Option C, circular motions. Option D, side to side. The correct answer is option B, front to back. Explanation. Washing from front to back moves bacteria away from the vaginal and urethral openings. Question 13. True or false, alcoholism can be cured? Option A, true. Option B, false. The correct answer is option B, false. Explanation. Alcoholism is a chronic condition that is managed, not cured. Question 14. What does the abbreviation DNR stand for? Option A, do not record. Option B, do not resuscitate. Option C, daily nursing report. Option D, do not remove. The correct answer is option B, do not resuscitate. Explanation. DNR is a medical order indicating that CPR should not be performed. Question 15. What should you use to provide mouth care to an unconscious resident? Option A, a standard toothbrush. Option B, a soft toothette or sponge swab. Option C, a wet cloth with soap. Option D, no care is needed. The correct answer is option B, a soft toothette or sponge swab. Explanation: toothettes are gentle and prevent the resident from biting down on a hard brush. Question 16. When performing passive range of motion, what is the responsibility of the nursing assistant? Option A, exercise past the point of pain. Option B, support the joint during movement. Option C, move as fast as possible. Option D, perform the exercise 10 times. The correct answer is option B, support the joint during movement. Explanation: providing physical support for the joint ensures safety and prevents injury during range of motion exercises. Question 17. What is the study of the aging process called? Option A, geriatrics. Option B, gerontology. Option C, pediatrics. Option D, anatomy. The correct answer is option B, gerontology. Explanation: gerontology focuses on the physical, social, and psychological aspects of growing older. Question 18. What is the medical definition of aphasia? Option A, inability to walk. Option B, loss of ability to speak or understand language. Option C, a severe skin infection. Option D, inability to swallow. The correct answer is option B, loss of ability to speak or understand language. Explanation: aphasia often occurs after a stroke or in advanced dementia. Question 19. What is the term for the wasting away of a muscle due to lack of use? Option A, atrophy. Option B, hypertrophy. Option C, dystrophy. Option D, aphasia. The correct answer is option A, atrophy. Explanation: atrophy is common in residents who are immobile or bedbound. Question 20. Where is the correct place to attach a urinary drainage bag on a bed? Option A, the side rail. Option B, the bed frame below the bladder. Option C, the headboard. Option D, on the floor. The correct answer is option B, the bed frame below the bladder. Explanation: the drainage bag must be attached to the non-moving bed frame and kept below bladder level to maintain gravity flow. Question 21. What is the primary role of an ombudsman in a long-term care facility? Option A, performing medical exams. Option B, managing the facility budget. Option C, protecting resident rights and investigating grievances. Option D, cooking resident meals. The correct answer is option C, protecting resident rights and investigating grievances. Explanation: the ombudsman acts as an independent advocate for the residents to ensure fair treatment. Question 22. What is the medical term for the stiffening of muscles after death? Option A, homeostasis. Option B, rigor mortis. Option C, peristalsis. Option D, atrophy. The correct answer is option B, rigor mortis. Explanation: rigor mortis is a natural process that occurs within a few hours of death. Question 23. When using a fracture pan, which side should be placed toward the back of the resident? Option A, the deep side. Option B, the side with the handle. Option C, the flat side. Option D, the side with the splash guard. The correct answer is option C, the flat side. Explanation: the thin, flat side of a fracture pan is designed to slide under the resident's buttocks with minimal movement. Question 24. Which member of the healthcare team is responsible for the overall nursing staff? Option A, the surgeon. Option B, the medical doctor. Option C, the director of nursing. Option D, the pharmacist. The correct answer is option C, the director of nursing. Explanation: the director of nursing manages all nursing operations and staff. Question 25. What is the clinical definition of tachypnea? Option A, slow breathing. Option B, fast breathing. Option C, normal breathing. Option D, painful breathing. The correct answer is option B, fast breathing. Explanation: tachypnea is a respiration rate that is higher than 20 breaths per minute. Question 26. Which precaution is used for tuberculosis? Option A, contact. Option B, airborne. Option C, droplet. Option D, no precautions. The correct answer is option B, airborne. Explanation: airborne precautions require specialized ventilation and masks. Question 27. What is medical asepsis also known as? Option A, sterile technique. Option B, clean technique. Option C, contamination. Option D, disinfection. The correct answer is option B, clean technique. Explanation: clean technique involves reducing the spread of germs. Question 28. On which side should a resident hold their cane? Option A, the weak side. Option B, the strong side. Option C, the side they prefer. Option D, it does not matter. The correct answer is option B, the strong side. Explanation. The cane provides balance and support when held on the unaffected side. Question 29. The brain and the spinal cord make up which part of the nervous system? Option A, the peripheral nervous system. Option B, the central nervous system. Option C, the autonomic nervous system. Option D, the skeletal system. The correct answer is option B, the central nervous system. Explanation. The central nervous system is the main control center for the body's functions. Question 30. What is an embolus? Option A, a stationary blood clot. Option B, a traveling blood clot or object in the bloodstream. Option C, a type of skin rash. Option D, a broken bone. The correct answer is option B, a traveling blood clot or object in the bloodstream. Explanation. Emboli are life-threatening if they lodge in the heart, lungs, or brain. Question 31. What does the military time 2200 correspond to? Option A, 10 o'clock in the morning. Option B, 10 o'clock at night. Option C, 8 o'clock in the evening. Option D, midnight. The correct answer is option B, 10 o'clock at night. Explanation. To convert military time past 1200, you subtract 12 to get the PM time. Question 32. What is the first step when cleaning dentures to protect them from breaking? Option A, rinse them in bleach. Option B, line the sink with a towel or water. Option C, use a metal brush. Option D, hold them with pliers. The correct answer is option B, line the sink with a towel or water. Explanation. Patting the sink prevents the dentures from shattering if they are accidentally dropped during cleaning. Question 33. Which of the following is an example of objective data? Option A, the resident says they have a headache. Option B, the resident's temperature is 101 degrees. Option C, the resident feels sad. Option D, the resident is hungry. The correct answer is option B, the resident's temperature is 101 degrees. Explanation. Objective data is a fact that can be measured or seen by the caregiver. Question 34. At what minimum angle should a dependent resident be positioned for feeding? Option A, 30 degrees. Option B, 45 degrees. Option C, 60 degrees. Option D, flat on the back. The correct answer is option C, 60 degrees. Explanation. Residents must be upright at a minimum of 60 degrees to prevent choking and aspiration during meals. Question 35. What is the medical term for sweating heavily? Option A, dehydration. Option B, diaphoresis. Option C, jaundice. Option D, cyanosis. The correct answer is option B, diaphoresis. Explanation. Diaphoresis can indicate pain, fever, or a cardiac emergency. Question 36. What is the definition of oliguria? Option A, abnormally large amounts of urine. Option B, small or scant amounts of urine. Option C, painful urination. Option D, sugar in the urine. The correct answer is option B, small or scant amounts of urine. Explanation. Oliguria can be a sign of dehydration or kidney failure and must be reported. Question 37. Which term describes urinating frequently during the night? Option A, dysuria. Option B, hematuria. Option C, nocturia. Option D, oliguria. The correct answer is option C, nocturia. Explanation. Nocturia is a common condition in elderly residents that can affect sleep and safety. Question 38. When drying your hands after washing, which method is correct? Option A, use a shared cloth towel. Option B, use a dry paper towel. Option C, use your uniform. Option D, air dry only. The correct answer is option B, use a dry paper towel. Explanation. Using a clean, dry paper towel ensures that the hands remain uncontaminated after washing. Question 39. What is the primary role of the certified nursing assistant? Option A, perform surgery. Option B, prescribe medications. Option C, assist the nurse with basic care and data collection. Option D, manage the building. The correct answer is option C, assist the nurse with basic care and data collection. Explanation. Assistants provide the direct daily care for the residents. Question 40. Where should a Foley bag be attached to the bed? Option A, the side rail. Option B, the bed frame. Option C, the headboard. Option D, the footboard. The correct answer is option B, the bed frame. Explanation. The bag must be on the frame to prevent pulling when the rails are moved. Question 41. What is the best position for a resident when applying anti-embolism stockings? Option A, standing at the bedside. Option B, sitting in a wheelchair. Option C, lying in bed or with feet elevated. Option D, walking in the hallway. The correct answer is option C, lying in bed or with feet elevated. Explanation. Stockings should be applied while the legs are elevated or the resident is in bed to ensure minimal swelling. Question 42. What does the clinical term PRN mean? Option A, before meals. Option B, after meals. Option C, as needed. Option D, at bedtime. The correct answer is option C, as needed. Explanation. PRN stands for pro re nata and indicates a task performed as the situation requires. Question 43. True or false, a resident has the right to refuse a bath? Option A, true. Option B, false. The correct answer is option A, true. Explanation. Residents have the right to refuse any part of their care. Question 44. Which type of tissue covers the internal and external surfaces of the body? Option A, connective tissue. Option B, nerve tissue. Option C, muscle tissue. Option D, epithelial tissue. The correct answer is option D, epithelial tissue. Explanation. Epithelial tissue forms the skin and the linings of internal organs. Question 45. What is the term for a drop in blood pressure when a person stands up suddenly? Option A, hypertension. Option B, orthostatic hypotension. Option C, hypoxia. Option D, apnea. The correct answer is option B, orthostatic hypotension. Explanation. This condition can cause dizziness and increase the risk of falls. Question 46. What is the medical term for the presence of blood in the urine? Option A, dysuria. Option B, hematuria. Option C, nocturia. Option D, polyuria. The correct answer is option B, hematuria. Explanation. Hematuria is a sign of infection or injury that must be reported to the nurse. Question 47. What does it mean to be NPO? Option A, nothing by mouth. Option B, normal pulse only. Option C, new patient only. Option D, needs physical observation. The correct answer is option A, nothing by mouth. Explanation. NPO is a strict medical order for no oral intake. Question 48. How many people are required to safely perform a log rolling procedure? Option A, at least 1. Option B, at least 2. Option C, at least 3. Option D, 4 people. The correct answer is option B, at least 2. Explanation. Log rolling requires a minimum of 2 staff members to maintain the alignment of the resident's head, spine, and legs. Question 49. What is the standard ratio for adult chest compressions to breaths in CPR? Option A, 15 to 2. Option B, 30 to 2. Option C, 10 to 1. Option D, 50 to 5. The correct answer is option B, 30 to 2. Explanation. 30 compressions followed by 2 breaths is the basic life support standard. Question 50. What does the term cyanosis indicate? Option A, high blood sugar. Option B, low oxygen levels in the blood. Option C, a bacterial infection. Option D, a lack of dietary protein. The correct answer is option B, low oxygen levels in the blood. Explanation. Cyanosis presents as a blue or gray color in the skin or nail beds. Question 51. Which term refers to the stiffening of skeletal muscles after death? Option A, homeostasis. Option B, rigor mortis. Option C, peristalsis. Option D, atrophy. The correct answer is option B, rigor mortis. Explanation. Rigor mortis is a sign that the body is entering the postmortem phase. Question 52. Threatening to harm someone without their consent is defined as what? Option A, assault. Option B, battery. Option C, neglect. Option D, libel. The correct answer is option A, assault. Explanation. Assault is the threat of force that causes a person to fear for their safety. Question 53. Which type of tissue connects and supports other tissues in the body? Option A, epithelial tissue. Option B, muscle tissue. Option C, connective tissue. Option D, nerve tissue. The correct answer is option C, connective tissue. Explanation. Connective tissue includes bones, cartilage, and fat that hold the body together. Question 54. Where are handrails located? Option A, in the bathroom. Option B, in the hallways. Option C, on the bed. Option D, in the kitchen. The correct answer is option B, in the hallways. Explanation. Handrails provide support while residents walk through the facility. Question 55. What unit is used for measuring and recording blood pressure? Option A, milliliters. Option B, millimeters of mercury. Option C, degrees. Option D, ounces. The correct answer is option B, millimeters of mercury. Explanation. Blood pressure is a measurement of the force of blood against artery walls.